Interventional cardiologists. One of the common decision-making process that we need to consider after a coronary angiogram is to help the patients decide whether they should proceed with an invasive procedure or whether medical therapy is sufficient or whether they should proceed with bypass surgery. Traditionally, if you have a minor blockage only, meaning blockages less than 70% on the coronary angiogram, the stenosis is less than 70%, then one would consider medical therapy, meaning taking pills. If you have a significant blockage, the traditional treatment would be coronary angioplasty if this was straightforward, a single blockage more than 70% or 80% in severity. If you have multiple blockages or blockages which are complex due to calcification, complete occlusions, multiple stenosis, then in many occasions in the past, these patients would be referred to a bypass operation. However, recent developments in the field of interventional cardiology has allowed us to consider taking on more complex procedure, and the lines between going for bypass surgery and interventional cardiology procedure has blurred. Angioplasty in the past was a very simple procedure. It's done under local anesthesia, as I've explained before, where we insert a catheter and through that a wire and balloon is put across a stenotic lesion, and through that the balloon is inflated to crack open the blockage and a stent is subsequently inserted. That is in a nutshell how angioplasty is done. But increasingly, there are a lot of new devices that allow us to tackle other kinds of blockages as well. I'll show you an example, angiogram of a patient with very calcified vessels. And you can see from this angiogram video that the arteries are very calcified with the thickening of along the walls of the vessels. That thickening is basically all hard calcium. When one look at this picture such as this, one would normally consider sending these patients to a surgeon if you are not able to open up the blockages with a balloon angioplasty. As I said earlier, what would happen if you put a balloon down, the balloon may not open the blockage because the vessels are basically so hard, it's like an eggshell. The balloon just can't crack it, right? So there are new devices now that allow us to crack these vessels. There are, in fact, a variety of devices and new technology that now allow us to tackle these complex lesions that were previously not possible by simple angioplasty. Such devices include the use of new atherectomy devices such as the rotablator or rotational atherectomy or orbital atherectomy, the Diamondback system, and even using ultrasonic devices such as the shockwave lithotripsy technology to crack open some of these calcified plaques. In the next session, I will be discussing in more details about some of these new exciting technology that now allow us to tackle these complex cases.
Thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.